People keep saying there's a big pharma conspiracy. But here's the part no one bothers to ask. What's actually real and what's just noise? Today, we cut through the nonsense. No sugarcoating, just money, power, medicine, and the uncomfortable truth sitting between them. Let's start with the structure. 5 to 10 corporations control most of the global pharmaceutical market. They're not evil comic book villains. They're something much more predictable. Profit-driven machines with no emotional brakes. They don't wake up thinking about your health. They wake up thinking about quarterly earnings. And when a health system depends on profit, decisions twist themselves around money, not people. It's a simple, cold calculation. The entire system is built on a foundation of financial incentives, and that's where the problems begin. It's not about good guys and bad guys. It's about a machine designed for one purpose, and that purpose is profit, not your well-being. So where does all this distrust come from? Conspiracies don't just appear from thin air. They grow from real screw-ups and legitimate grievances. Think about it. We've seen life-saving drugs with prices jacked up to astronomical levels. We've seen documented cases of companies hiding negative clinical trial data to make a drug look better than it is. We've witnessed aggressive lobbying in Washington to shape laws in their favor. And who can forget the manipulation of opioid risks that fueled a devastating crisis? These aren't theories or whispers in the dark. These are documented, public cases that have resulted in massive fines and lawsuits. So when people start talking about a conspiracy, they're not just making things up. They're reacting to a pattern of behavior that these companies created themselves, a pattern that repeatedly prioritizes profit over public safety. Now, let's talk about incentives, because incentives shape outcomes. Here's a hard question. When curing a disease earns a company less money than treating it for a lifetime, where do you think the investment money is going to flow? The answer is obvious. Companies pour billions of dollars into developing drugs that manage chronic conditions, drugs you have to take every day for years, or even for the rest of your life. Why? It's all about predictable revenue streams. A one-time cure is a one-time payment. A lifelong treatment is a subscription model for your health. This isn't because they're sitting in a boardroom plotting your destruction. It's because the system we have fundamentally rewards endless treatment over permanent solutions. That isn't a conspiracy. That's just capitalism running without any brakes. And how is information controlled in this system? Medicine relies on data. Clinical trials, research papers, expert recommendations. It's all built on a mountain of information. But here's the catch. Who generates most of that data? The very same companies that stand to profit from the drug being studied. Now, they're not usually forging numbers outright. That's crude and blows up in their face instantly. The trick is much softer, much more subtle. It's about selective publication, where they only publish the trials with positive results. It's about strategic framing, where they present data in the most flattering way possible. It's about ghost-written studies, where company marketers write the paper and then pay a respected academic to put their name on it. And it's about funding university research labs that already lean their way, ensuring a steady stream of favorable findings. All of this is perfectly legal. It's polished. And it shapes the medical narrative far more effectively than any secret meeting in a dark basement ever could. People love to claim that governments and pharma are working together in some kind of secret global plot. The reality is both simpler and more mundane. Regulators, like the FDA, are supposed to be the watchdogs. But they rely heavily on the industry they're supposed to be policing. They depend on the pharmaceutical companies for the expertise, the clinical trial data, and the funding for the approval process itself. This creates a state of dependency. And dependency inevitably creates influence. This influence isn't some grand conspiracy being hatched in a secret room. It's a slow creep. It's a revolving door where regulators leave their government jobs for high-paying positions in the industry, and vice versa. Over time, you get a system where the watchdog ends up sleeping right next to the wolf, not because of a sinister plot, but because their interests have become slowly and quietly aligned. Now, let's be blunt for a moment. While there are real systemic issues, there are also ideas spreading online that are complete and utter nonsense. I'm talking about the wilder theories: secret population control drugs hidden in vaccines, miracle cures for cancer being deliberately suppressed by doctors, or the idea that major diseases are just invented out of thin air by corporations to sell medicine. None of this holds up to any real scrutiny. These ideas spread like wildfire because people hate feeling powerless. Facing a complicated, broken system is overwhelming. It feels so much easier when you can just blame a single, cartoonish villain for everything. It simplifies the world, but it doesn't get us any closer to the truth or a real solution. So, what's the one thing they really don't want you to talk about? It's not a secret cabal or a hidden agenda. The real, terrifying problem is that the entire system is built so that profits almost always win, even when public health loses. There's no conspiracy needed when the incentives are already set up to push everything in the same direction. That's why drug prices keep rising, even for old medications. That's why research priorities skew towards profitable long-term treatments instead of cures. And that's why public trust has completely collapsed. The machine is working exactly as it was designed, to maximize financial returns. The horrifying part is that our health is just another raw material in that machine. So here's the truth. You're not living inside a grand pharmaceutical conspiracy. You're living inside a giant economic engine where health is a product and your body is a potential revenue stream. The real danger isn't hidden in the shadows. It's written down in black and white on corporate quarterly reports and shareholder meetings. It's sitting in plain sight, in the logic of the market itself. And the only way anything changes is when people stop chasing fairy tales about secret villains and start attacking the real problem. A system where money, not well-being, decides who gets to live a healthy life. We need to question the incentives, demand transparency, and advocate for a model where patient health is the bottom line. Thanks for watching. If this opened your eyes, consider subscribing for more content that cuts through the noise.